Okay, so this is Chapter 3, Infection Control, Safety, First Aid, and Personal Wellness. Again, remember you can pause the video at any point to review slides, take notes, or anything like that. So at this point, I want you guys to go ahead and take a moment to review the objectives of the chapter. Okay, so this slide is talking about what the definition of an infection is. Of course, that is when a microorganism invades your body, multiplies, and causes injury or disease. For this purpose, we're going to look at the microbes listed right there, so go ahead and familiarize yourself with those kind of things. There are, of course, microbes that live within your body all the time that don't cause infection, and we differentiate these from the ones that do cause disease using the term pathogen. So a microbe that lives inside your body that causes disease is called a pathogen. Okay, so I want you guys to be aware of the difference between the types of infection. There's communicable, which is able to spread from person to person, and there's nosocomial or health care associated infections. These are infections acquired while a patient is in a hospital or other healthcare settings. As you can see, it is a pretty big deal. There's 99,000 associated deaths per year from nosocomial infections. Again, these being the ones that a patient contracts while actually in the healthcare facility. Okay, so this slide is talking about the chain of infection, starting from the infectious or causative agent, then a use of a reservoir, and the exit pathway. An example I'm going to use is malaria being the causative agent. The reservoir for malaria is, of course, the mosquito. And then the exit pathway is, or the way an infectious agent is able to get into the reservoir host, in our example, the human, is when the mosquito feeds on the human. Alright, there's several means of transmission for infection. Airborne, an example of that is tuberculosis. There's contact, direct, as in touching or kissing, like mononucleosis. Indirect, contaminated objects, such as like a staph infection. Droplet, an example would be like the cold virus, the rhinovirus. Vector goes along with the example I gave earlier, malaria. And vehicle, food, water, or drugs like salmonella you get from eating contaminated food. Okay, so this slide's talking about the entry pathway, or ways a pathogen enter the body. This includes body orifices, mucous membranes, and breaks in the skin. It also mentions a susceptible host, which is someone with a decreased ability to resist infection, or in other words, immunocompromised, either through a disease or it can be from medications a patient is taking. Most commonly associated with like cancer patients on chemotherapy. Stuff like that will really reduce a person's immune system. Other natural factors include age, a person's health, and their, of course, immune status. Okay, so this slide talks about ways to prevent the spread of infection. The one that's going to be most important for you guys when you're in the job is proper hand hygiene. Also the use of gloves, gowns, masks, and respirators. This slide's talking about an infection control program. These are preventative measures you will have to undergo to protect yourself. No matter where you work, they will be sure you're thoroughly trained in infection control. Okay, so as I mentioned above, hand hygiene is by far the most important factor. You should always practice proper hand hygiene. Also, in a hospital or healthcare setting, you will receive personal protective equipment. Please look over all the parts of personal protective equipment and the proper steps for donning and removing it. Okay, so this is talking about isolation procedures. Some situations patients will be put on isolation. For example, if they have Clostridium difficile, which is usually one of the nosocomial infections a patient can contract while in the hospital. Also, like for MRSA, methicillin-resistant Staph aureus infections, patients will be put on isolation. And this just talks about the process of them getting put on isolation, which mostly will be done by a nurse, but you will need to be aware if a patient is on isolation, if they are in isolation for any reason. So review these slides, and they'll talk about different kinds of isolation. Okay, so this slide talks about standard precautions, which are, you should assume that any patient is capable of transmitting a disease. And you can see right here it says it's the #1 strategy for control of nosocomial infections, which up to this point we've talked about being pretty significant. This slide talks about the 3 types of isolation: airborne, droplet, and contact. Okay, so the following slides are going to discuss biohazards and various routes of exposure. Okay, so these are the routes. There's airborne, which means through the air; ingestion, something you consume; non-intact skin like a wound or something; percutaneous, through the skin; and permucosal, through the mucous membranes. This slide is starting to talk about bloodborne pathogens. Hep B is one of the more common pathogens you could be exposed to. Fortunately, to be employed, you will be required to have the Hep B vaccine, but if you use standard precautions in your personal protective equipment, it shouldn't be an issue for you anyways. As you can see, some of these things are very hardy. This can survive up to a week on objects. Okay, this is Hep C virus, which is not as common as Hep B, but shows many of the same cycles and symptoms as Hep B. Alright, so the following few slides discuss OSHA, or discuss OSHA's protocols for dealing with exposures to bloodborne pathogens. I want you guys to take a moment to review these, paying close attention to the control plan documentation's exposure route and incident procedure. Again, there may be variations of these procedures depending on where you work. These are the various exposure routes of bloodborne pathogens. Okay, so this slide discusses means to reduce risks around the work area. Most labs, hospitals, health environments have trained teams to deal with excessive spills of chemicals or biohazardous body fluids. This is dealing with electrical safety. This is talking about fire safety. These are general common sense actions to take if a fire occurs. Most facilities will have their own specific procedures. Okay, on this slide I want you guys to pay attention to the bolded words. Know the three components needed for a fire. Okay, so the following slides review the 5 classes of fire. Review these carefully, making sure you understand the difference between each. Class A, Class B, and Class C. Class D and Class K now. Again, take a moment to review these, make sure you know the difference between them. This slide talks about radiation safety. This one is talking about chemical safety. Make sure you should in any instance, but always make sure you wear your personal protective equipment. And then I want you to review some of the conditions to never find yourself in when dealing with chemicals. Those are the ones on the right of this slide. Okay, so the following slides are going to talk about different requirements from OSHA about chemical safety. Any chemical is required by OSHA to be labeled with the following info, which you can see right there. Also, each is required to maintain an MSDS, which is a material safety data sheet, which can either be found as a hard copy or online at the facility you work at. Every chemical you might have to work with will have one of these sheets. And these are just showing examples of labels. Okay, one thing you should always be aware of wherever you're working at is the location of safety showers and eye wash stations. Alright, so the remaining slides discuss various conditions you could experience with patients, as well as personal actions you can take to maintain your professionalism. I'm not going to go through these individually. Just make sure you guys take some time to review them and be familiar with the stuff on the following slides.